Hear me now?
Yes, sir.
International Forum for Promotion of Homeopathy, IFPH, is a forum of homeopathic doctors, homeopathic lovers, and benefactors for homeopathy. And this forum is conducting for the last 355 days uninterrupted Zoom meetings every day in English and Malayalam. And today we have a very special guest, Dr. L.K Nandha, Dr. Nandha from Orissa, a leading clinician and academician, and who is the chairman of the Special Committee of Clinical Research Central Council for Research in Homeopathy, and who was the former principal of the Abhin Chandra Homeopathic Medical College, Bhubaneswar, and who was the member of the Central Council of Homeopathy and my colleague in the Education Committee of the Central Council of Homeopathy. I am very happy to introduce him to this forum, and also I wish all our participants a very, very happy Onam, one of the leading state festivals of Kerala. Sir, please come to the forum and make your presentation. Please unmute Dr. L.K Nandha, Lakshmikant Nandha.
Sir, please unmute yourself, sir.
Yes.
Okay.
Am I audible?
Yes. Okay.
Good evening to my friend Dr. Jose, others present in the meeting, and Dr. Manoj and others present in the meeting. Okay. So I am very happy and glad to join in today's meeting conducted by this international forum, and I'm happy that this international forum is taking a lot of interest to promote homeopathy in India and abroad. So I am again grateful. My regards to Dr. Jose and the members of this forum, conducting so many programs in so many days, which is very important, and which is actually difficult to maintain for such a long period, this type of discussion forum, etc. And I, from my core of my heart, I give thanks to all members, my friend Dr. Jose, for maintaining such, for promoting, upgrading homeopathy for the practitioners. So we can go directly to the topic, sir?
Yeah.
Okay. So can I put my PowerPoint now?
Yeah, you can unmute. You can do it from your end.
So good evening to all the participants from my side. And my topic today is to discuss homeopathic approach to pre-malignant and space-occupying tumors. We all know, next to heart attack, malignancy is the next leading cause of mortality in the globe. Radiotherapy, chemotherapy, surgery is the usual approach to these conditions in the allopathic system, which is still a challenge to cure or stop recurrence. In homeopathy, we often observe effectiveness because of its holistic approach. So, a retrospective study is made on 30 patients who have undergone treatment for 2 years in my clinic, out of which 15 are benign space-occupying tumors and 15 are pre-malignant tumors. And this study I have done with an objective to statistically evaluate scope of homeopathy in tumors and pre-malignant conditions basing on pre and post investigation reports. Cases included in this study whose clinical diagnosis was confirmed by CT scan, MRI reports, and histopathological reports. Let us see what are the cases I have included in my study. So out of 15 benign space-occupying tumors, meningioma cases are 2, microadenoma pituitary are 2, uterine fibroid 5 cases, polycystic ovarian syndrome 2 cases, pseudopancreatic tumor of pancreas 2 cases, gallbladder polyp 2 cases, and 15 cases I have taken for pre-malignant conditions, out of which astrocytoma is 1 case, glioma is 1 case, cervical interepithelial neoplasia, that is CIN, as we know, grade 1 case, CIN grade 2 cases, and CIN grade 3 cases. These are all pre-malignant cervical cancer cases, and leukoplakia 4 cases, and salivary adenoma 3 cases. So in this study, I have included 30 cases, out of which 15 are benign and 15 are malignant, 15 are pre-malignant in nature. So while treating those cases, the selection of medicine, potency, repetition schedule are strictly according to classical homeopathic principles. I will discuss with each case while I'll give a case study. Patients are assessed with the clinical, radiological, histopathology report in 6 months interval. After 2 years of treatment, results were assessed using the statistical method 1 sample proportion test. See, what are the improvements of these cases? See, I have made 3 parameters, that is marked improvement, partial improvement, no improvement. These improvements are statistically made keeping an eye on the size of tumor, histopathology reports, and the MRI reports. Suppose the size of tumor reduces to 0 to 1 mm, then it is marked improvement. Size of tumor reduced to 1 to 5 mm, partial improvement. No decrease in size of tumor, no improvement. So likewise, I have fixed a parameter. This is a detailed study because time is 40 minutes. I just cursed everything for going to case in detail. So out of 2 meningioma cases I treated in my study, there is one is marked improvement that I will show you today. The size of tumor was grossly reduced to 0 to 1 mm. That is nil. In one case, I will give you the reports, pre and post reports, including MRI reports and also the clinical sign symptoms. Out of 2 meningioma, 1 marked improvement, 1 partial improvement, and out of 2 microadenoma pituitary cases, that is, there are 2, this see in homeopathy, microadenoma pituitary is very, very amenable for homeopathic treatments. See, out of 2 microadenoma pituitary cases, the 2 are improved. And for pseudopancreatic tumor, this is also everybody has experienced, all practitioners must be knowing pseudopancreatic tumor causes a lot of problems in the body, but in homeopathy, the pseudopancreatic tumors are also very good for treatment, and out of 2 cases, 2 completely cured. Polycystic ovarian syndrome, out of 2 cases, 1 marked improvement, there is 1 partial improvement. Out of 5 cases of uterine fibroid, there is 2 marked improvement, 2 partial improvement, and there is 1 case not improved. And gallbladder polyp is a difficult case, and I treated 2 cases, none of them improved, and the 2 cases are not improved. Similarly, coming to pre-malignant diseases or conditions, that is, I have got 3 cases of salivary adenoma. Out of 3 cases, there are 2 marked improvement. I will show today the reports. And out of cervical interepithelial neoplasia grade 1, that is a precancerous condition of cervix. Out of 3 cases, 1 has marked improvement, 2 has partial improvement. I will just show you the evidence of reports. And out of CIN grade 2, out of 2 are partially improved. And out of CIN grade 3, which is actually very severe, advanced pre-malignant conditions for cancer cervix, there is no improvement. Leukoplakia, we are getting a lot of patients in practice. Almost all homeopaths are getting leukoplakia, a pre-malignant conditions in their practice, and it is very good amenable. It is very good. It responds very nicely to homeopathic treatments. So out of 4 leukoplakia cases, 1 has completely improved and 3 has partially improved. Glioma is a precancerous condition. Out of 1 glioma, there is a partial improvement. In astrocytoma, a more advanced pre-malignant brain tumor. This case didn't respond in my treatment. All these cures are evidence-based and there are all reports with me, but because of pursuit of time, I'll just present 4 cases today in this introduction, in this discussion. Coming to the first case, so today I'll discuss 2 cases, 1 case of salivary adenoma, 1 case of cervical interepithelial neoplasia grade 1, and 2 cases, 1 case of petrous meningioma and 1 case of pituitary adenoma with pre and post treated reports. Coming to the cases, first I will present a case of salivary adenoma. This is the case of P. Srichandan. You just look to the tumor here. Premandibular salivary adenoma. This is patient is P. Srichandan, and what we have seen is small swelling on right submandibular region. On examination, a firm, hard, mild, tender swelling in the right side of the submandibular region. Diagnosed by surgeon, pleomorphic salivary adenoma of submandibular salivary gland. And as you know, from our surgery knowledge, parotid glands adenoma are common, but chances of malignant is in 10 to 20%. In submandibular gland, it is uncommon, but chances of malignancy is 50%. And sublingual adenoma is very rare, but chances of malignancy is 85%. So this is a submandibular gland adenoma. So the surgeon advised for FNAC. The FNAC report, see the microscopy report, smear shows sheets of epithelial cells arranged in capillary pattern, microscopic appearance. Smear shows sheets of epithelial cells arranged in papillary pattern with elongated nuclei, which is a sign of carcinomatous or say sign of changes of carcinomatous changes. Elongated nucleus, some showing abnormal nuclei, some showing nuclear groove, cyst, macrophage, and lymphocytes on necrotic background. So impression, you see, possibility of papillary carcinoma cannot be ruled out. This is the impression in the pathology report. This is advised by the surgeon B.K. Sahu. So oncologist, after seeing this report, immediately advised for operation because am I audible, sir?
Yes, yes, no problem.
Thank you. So after seeing this report, the surgeon advised that immediately go for operation. This is a histopathology shows that there is chances of cancerous changes in your tumor, in the submandibular tumor. So go immediately for operation. The patient is a poor one, so he came to me for treatment. He told that I may die, but I can't afford say around 50,000 rupees for complete eradication of the tumor in the mandibular gland. So I will stick to you. So present complaint, there is a hard swelling, as I have told you, in submandibular region, increasing gradually, mild pain when exposed to cold, damp weather, pain at evening, pain lying on left side, pain aggravates after sleep in afternoon, tremendous weakness, and there is a history of chronic orchitis with a hard indurated testis since 2 years. Past history of the patient, a recurrent chronic orchitis leading to hardness of testis, past history of all vaccines, chickenpox, family history of mother have fibroadenoma of breast, sister, uterine fibroid, father tuberculosis, and lastly died of cancer lungs. Mental symptom of the patient is as reported by his family members, very irritable, ill-humored, argumentative, sluggish in nature, hurried, talks hastily, and while talking shallows words, as you know, very hasty speakers, mixing nature, but now gradually isolated himself because that he already knew that suffering from pre-malignant conditions, so underwent depression. His son reported not coming out of room, not attending office, though not so weak, causing financial burden to family. Mental symptom continuing, on repeated asking to the patient, "Arey, you are not suffering from cancer. It is never a cancer. Why don't you go to the office? Why are you losing your salary?" The patient told that, "No, sir, I know I am suffering from cancer for which my surgeon advised for surgery." So it repeatedly telling that because my death is approaching, I feel some other person's spirits are in the room. See the fixed idea. See it is a delusion. See, he felt that somebody looks over his shoulder. He again felt that he is confined to one room, sit alone, moves around in a circle type of room. This is a common symptom of all cancer depressed patient sitting alone in the room. Analysis of the case, delusion, someone behind him because of persistent belief he will die of cancer for which doctors advise operation. There is a persistent belief, delusion that another person, spirits are in the room to take away his soul after his death. They are all delusion of the patient. The patient is sluggish, dull, argumentative, quarrelsome, irritable, ill-humored, hurried, talks hastily, walks in a room restlessly. Desires salt, sweet onion, intolerance, fatty food, pain in glands, aggravation by cold, induration of glands, both salivary and testis. My reputation, the drugs came like this: Staphylococcus, thuja, silesia, sulfur, phosphorus, natromure. So my totality and evaluation I made in this way that I gave always importance to delusion, then etiology, then mental symptoms, physical general, and lastly the particular symptom, that adenoma, tumor, etc., etc. And while selecting medicines, I give an emphasis to miasmatic coverage, then also consider past history, family history, and finally I select the medicine. So why I am giving importance to delusion? As you know, in Kent's repertory, in synthesis, delusion covers highest page in the repertory in the mind symptom. Why? Because delusion is the very, very important symptom to be taken into account by a homeopath to cure any chronic case. So then, but many doctors are missing this point. Many doctors are ignoring delusion in their practice. But then what is delusion? Delusion is a very, very important symptom, and daily all homeopaths, all of us are coming a lot of delusion symptoms with the patients. But as you're ignorant about these symptoms, so we miss the symptoms. And then what is delusion? Delusion is the intense, exaggerated feeling of a normal fact, which becomes dominant, fixed in patient's mind, and accordingly affect his emotion and behavior. I can tell you one example that every day we are coming across a lot of hazards, a lot of problems in the life. But as if our vital force is strong, then we overcome this point. As somebody told me, let him told. So likewise, but whose vital force is weak, that point stopped his mind on his mind. That once remained stopped in his mind, and he thought why he told me, and likewise. So I'll give you some examples to clear you. child, 12 years biotech child, already he known that his IQ is less, and there is he knows that I am mentally inferior to other children. So there is a delusion, always he felt. Delusion means a feeling with the child that he always felt that he is being laughed at, because in his mind, that is, it is talked that he is having less IQ, he is having less knowledge. So always, though nobody is criticizing, though nobody is laughing at him, but he thought that others are laughing at him. This is delusion of the biological child. Always he feels that he is being criticized when nobody is criticizing. These are all delusions. That means an intense feeling with the child that I am being criticized, because though nobody is criticizing, but he felt that because in his mind there is an idea that I am inferior, and so because I am inferior in the mental, inferior in my IQ, others are laughing in behind me. It's a delusion. So I always give emphasis delusion. And in my practice I observe that the patients are telling delusion according to themselves. One example I'll tell you, old men are coming and telling that, sir, I am being neglected. Why? Actually, he is not neglected. His children are taking utmost care. But he felt that I am old. I am no more equal by my family. So that idea stuck in his mind and felt I am neglected. Though he is not neglected. These are all delusions that are coming in practice. So, so I always give any delusion symptom I will get in my any case. I will give emphasis that point. So let us see the delusion in this case. In our reportation, the first problem subsagria. So let us see the subsagria also covers delusion some person in his room, but subsagria delusion some persons in his room, because we know subsagria, the patient is conscious of his dignity and prestige. The patient is very much conscious of his dignity and prestige, highly conscious towards the feeling of others. So always looks back here and there. Anybody is observing me. Why? If I make some mistake, they may feel bad. So because of his consciousness towards others' feeling, he always looks here and there back that others are observing me. Somebody is in the room. This is subsagria delusion. That is that he is same like Thuja, same like Anacardium, same like Silesia, or another person in the room, because he is always concerned that others are looking his hurt, and for that he is looking anybody in the room or not. That is a delusion. Yeah, same like subsagria, there is a delusion others are in his room. It is because the same point. We know Silesia has a fixed idea, and he always tries to retain his fixed image before others. I am a scientist, so I must be praised as a scientist. So he always looks that anybody looking his fault, anybody is criticizing to his caliber. So he looks here and there, and always a delusion that others are observing him in his room. Something else. He felt that somebody else in the room, but his delusion is because he is afraid of ghost, afraid of surgery, afraid of disease, tremendous fear of ghosts. So delusion, someone is walking behind him like a ghost. He has got a fixed idea that someone is in my bed, someone behind me, someone in my room. Because we know that Thuja has a fragility feeling. My leg is made up of wood made up of glass, would break easily, a feeling of fragility feeling. So Thuja patients are feeling that slightest disease, they felt I will die. So this patient has a delusion that I will die because there's a fixed idea in his mind, though the submandibular adenoma is pre-malignant, but there's a fixed idea in his mind that I will die and spirits are in my room to take away my spirits. So out of these subsagria, calculator, anacardium, Thuja, we will see that Thuja delusion is more towards this patient because he has a fixed idea, I will die of cancer and somebody else in the room to take away my spirit after my death. So, considering other factors, family history of hybridoma of breast, family history of uterus cancer, past history vaccination, chronic indurated testis. These are all indication of psychotic dominant miasm, and all the symptoms that cause some irritable, hurried, talks hastily, sad, depressed, selfish, and the peculiar delusion due to fixed idea, I will die and others are there in the room to take care of my spirit. All these things made me to select Thuja, and you see Thuja I started 200, 1M, 10M, and by giving Thuja, swelling, pain is reduced, but swelling is static, and pain is less than before. Not CM, but after 3 months of treatment, painless, swelling, static, but feels more hard, more indurated. I advised for another FNAC, but unluckily, FNAC shows, see this time, this is my advice, L.K NANDHA. I have advised for FNAC, and you see, this time the FNAC is not in favor of me. Again, the smear shows cluster of epithelial cells with round elongated nuclei arranged in papillary pattern, few showing nuclear groups. So all features of pre-malignant or malignant cells in this slide. Biopsy is strongly suggested to differentiate metastatic. So to differentiate metastatic papillary carcinoma or salivary neoplasm. So seeing this report, his surgeon scolded him, why are you taking homeopathy? Why don't you go for operation? Do you want to die from cancer? Again, the economic condition to forbids him to go for operation, and again he told that, sir, please treat me. Whatever is there, I will suffer. So I know that in aphorism 5, if the case is not improved, then we have to reconsider the case, or the case is incurable. So I thought, let me reconsider the case. I took up the case again. In totality, give emphasis to delusion, then etiology, then mental symptom. So when delusion, giving emphasis to delusion, I failed. I thought that let me inquire regarding etiology. Inquiring etiology, he told that when I asked him how it happened, he told that, sir, I went to Puri, a good sea beach in Odisha, and took sea bath. Then after that, I came in the heat of sun to my native place, Khorda, 50 kilometers away from Puri. And after that, I suffered from fever, and then there is a soreness of my gland, and this increases. So I told that, why don't you tell this point to me? In the first attack, I asked you, what is the causation? He told that, sir, I am near to Chilika, and I am fishing in Chilika Lake, sea water several times. So there is no problem with me. Why should I think that sea bathing in Puri will cause any disease? So I didn't tell. So taking into account that the disease may happen after sea bath and exposed to cold, and delusion, someone is behind him, in hypothyroid. You see, delusion, some people behind him, and aggravation by sea bathing, aggravation when exposed to sun. Bromium is the first drug comes. So giving emphasis to the peculiar etiology that better inside sea, but aggravation by sea bathing and exposed to heat and peculiar delusion, bromium prescribed. So the bromium prescribed here. Other drugs covering the sea bathing and exposed to heat is natriumur. Natriumur is also a drug for this patient because this patient suffered after bathing in sea, after exposed to heat, and the patient is irritable, silent, aloof, loner, isolated himself, easily angered, desires salt. These are all with this patient. But why natriumur is excluded? Because prominent symptoms like want a peculiar delusion that some people is behind him or in his room is not in natriumur, and there is a want of sensitivity of natriumur with this patient. Natriumur patient always thinks his responsibility towards his family. Then carcinosin, a drug which comes also nearer to this patient, but carcinosin patient something else. Carcinosin, as you know, is a very good drug for pre-malignant conditions, but carcinosis patient has a tendency to perform all things exceedingly well, a superhuman effort to survive. He's never frustrated. He's never depressed. Good control over oneself is very much. Even with cancer, he is optimistic that he will be cured. And a carcinosis patient is always ideal for others. Even during suffering, striving to be perfect parent, striving to be a perfect husband, striving for a good worker. A carcinosis patient is a sympathetic, good, and having a good and humorous always condition. And the carcinosis patient tend to accumulate all grief within himself and works accordingly. A very good character carcinosis, but this patient is selfish. Even with no suffering, he stick to a room and not earning money for the family. So this is never natriuretic carcinosis. Conime is a drug which also comes in the reputation sheet, but and also covers many points. Conime covers points like in conime also there is delusion. Some people in the house entering at night. In conime also there is a hard induration of glands, indifference to business, irritable. All these points are alike to this symptom. But the strong etiological factor, aggravation after sea birth, aggravation after exposed to sun is not in conime. So conime is also excluded. So considering the peculiar delusion, etiology, etc., chromium is selected, chromium 200, 1M, 10M, all prescribed, and after chromium, tumor is not palpable, patient feels better, no pain, and I see pre-malignant tumors are in my practice, as I have seen, a response to 10M higher potencies. So, while treating with chromium, he improved, but once upon a time he went again to lake and exposed to sea cold air, and she suffered from pain again. So there is a family history of tuberculosis, and the disease recurred after exposed to cold. So tuberculum 10M was given to clear the miasm in his constitution, and after tuberculum 10M, tumor is not palpable and pain subsides. But unluckily, there is a recurrence of severe itching of the body. And on asking him any history of tinea, he told that yes, long back I have tinea. So tuberculum complementary is sorinum. So sorinum is antisoric. So after sorinum 10M is given, and after giving sorinum 10M, you see the patient is completely all right. Skin symptom subsides. The tumor subsides. There is no pain. So I advised him for FNAC. The FNAC report. See, I have again, this is the third report advised by me. There is no malignant cell. Smear shows clusters of benign salivary epithelial cells and cyst macrophages on myxoid lymphoid background. Impression cytomorphology is suggestive of chronic cyanoadenitis with cystic degeneration. So there is no papilloid cells, there is no nuclear groove, there is no elongated nuclei in this microscopic appearance, and there is this is the complete free from the pre-cancerous cells. This is the post photograph. The tumor size is not there. Patient is all right. There is a video of the patient, but it will take time. I'll show you 3 more cases. Less time left. So this is.
Okay, maybe sir, we can come to the forum again. Now it is 40 minutes. So we have a book release function, and also we question answer session for 15 minutes.
How many times, sir? Hello? Hello? Dr. Jose, sir?
Yeah, no.
How many minutes?
No, now we will go to the book release session for 5.
And just
after that,
After that, we can discuss.
how many minutes you need? you complete the chapter.
Pardon, sir?
No,
Sir, how
two
many
more
minutes,
cases are
sir?
there. Two more
Take
cases.
10 minutes, 15 minutes. I'll just skip over, finish कर देंगे. As
No,
anything you like. Then
Sir, it is better we can have a second part for your session
no,
on
no,
another day.
as you like, no problem.
Yeah, because this is evidence based and you are showing all the records, everything. We want a second part for this
No
your
problem,
session.
sir. Okay, so carry on
Okay.
the program. We'll continue
Okay.
after that. Thank you.
Okay.
Thank you.
So now we'll have a book release session, and after that there will be a question answer session. So please be online. Okay.
Okay, thank you, sir.
Now I invite Dr. Yahya to come over for the release of the book by Dr. Mashood, a senior homeopath, and who is working in the NRHM department.
You had to invite our president. He's
Okay.
doing that.
Okay. Okay.
So it is better to close the screen share, sir.
Yes, Abel, please to share the screen of the book. Said, sir, please come.
Yes, I am here.
Yes, sir. Yes, sir.
Don't worry, don't worry. I am here. Taking the being onwards.
Yes, this is the book which is going to be released. Dr. Mashood is a product of Trivandrum Homeo Medical College. Now he is a medical officer. Since 25 years, he is working on this book. And so the unveiled micro secrets of homeo and herbals. So actually he is a degree holder in botany, and afterwards he took his BHMS. So Dr. Mashood, please unveil yourself first.
So is there?
Hello, sir. Can I hear? Hello,
Yes, yes.
sir, hearing?
Yes.
So there, yeah.
Okay, sir. Said, sir, you can continue.
We can continue. Okay, sir. We can start again.
No, I will
No,
call
sir,
you
no, sir.
later after 5 minutes.
Okay.
There's 1 or 2 minutes. In there. Sir, anyway, L.K Nandha, I am Dr. Ismail said. I am Dr.
Yeah,
Ismail
yeah.
the former principal of the
Yeah.
Homeopathy College. I know you very, very well. Maybe you are forgetting over something. You don't know me.
I don't know you.
I know you very well, very well.
I
You are
have-
evidently putting the cases and talking the students and everything is very fine. You are the classes, a very interesting classes one. And now we need 1 or 2 more sections from you. Then only we will get some satisfaction. Otherwise we will not get it. Because we are presenting every case with the evidence and report and everything. So we need your classes 1 or 2 sections more.
No
Other
problem,
than
sir.
this, we will invite you. We will invite you, sir.
I'll be very much happy, sir. I remember.
Okay, sir. Thank you.
I remember.
You remember me? Eh? You are remembering me?
Yes, sir. I remember.
Thank you very much.
I have gone to the house. I have seen the lot of questions you are seeing. In my
I am now 73 years running, and as per the Arabic saying, then 75 is over. Because 33 years adding one year now. So Arabic, I have the yesterday, I have birthday.
But you look like
Muharram
45.
Yeah. Eh?
You look like 45.
45.
I look like 85.
No. Anyway, my student, Mashood, is a brilliant student. He's having the very inventing character and discovery character also from the beginning. He's the first batch of the Trivandrum College. I think I am not seeing you personally. I know you very well. You are also contacted me several times. Anyway, your work is I not gone through all the work, but I referred here and there. I found it is very useful for the pharmacy people as well as those who are studying the mathematics in pharmacy, like that. One thing I tell you, your teacher, Dr. K. Gobi and Musa, is very poor in the studies of the pharmacy earlier. So one day they agitated me and I refused this paper when referring this one. So Dr. K. Gobi, as well as this one, Musa and Mohsin also came to me, sir, you have not done the proper thing or like that. So you are not studying the, properly with the mathematics and pharmacy. Pharmacy is very important thing. Is equally benefits for the mathematics. So you have to go through this permanently. So there's no use for the pharmacy like that. Told. Then I given a word to Dr. K. Bobby and Muhammad Musa. See, once you will be achieved more than this now you are studying. K. Kobe is a wonderful man who has wrote many books in the mathematical pharmacy, and Musa also gone as a head of the department of the pharmacy. So this is a story I have in this one. Once they refused the studying the pharmacy, finally they got the master of the pharmacy. K. Gobi is a very brilliant student, very silent one, but he wrote so many books about the mathematical pharmacy. Useful for the now student. So he's unveiled the macro secrets of the homeo and herbals. It's a wonderful work you have done last 25 years. So he achieved his in the way, but he want to know more and more because now you have got the appreciation from the public. Now you need more studies in pharmacy, and I think the nano theory is different from your study. Your study is the molecular value of this herbal and homeo medicines. Then the nano is a little more advanced maybe. So many doctors don't not agree with that method, but this method is a very common. I advise all the students to purchase the book and study well properly, so that they can achieve. You will do the work further and further. So I'm very happy to release in this book. This book. That's in, yeah.
Yes.
So with the permission of few people and the grace of Almighty Allah, I am in the name of Almighty and I releasing this book for the purpose of the whole community and whole fraternity of the homeopathy. Thank you. God bless you, Mr. Masood. We will achieve this one. You study more and more, then you publish more books in the field. Thank you. God bless you again.
Mashood, so few
Thank you,
words.
sir. Thank you, Lord, sir. And I thanks to the IFPH platform. I was attending all the 45 days, 55 days as the name Munar, APHC.
Because I see him several
And
times.
I was,
I don't identify you.
today,
We are all
yes,
seeing you
but
today.
I am attending this in my house. That because APHC color I transferred from DK district to Trivandrum by my request. And I'm so happy, and I am so much thankful to the APH. And I want to say something about this. This is to show about some crystals found from the medicinal plants. And accidentally it was got from Dr. Latif Sir's work. That is, I don't know, I don't praising him, but I bought him from some medicine from him and tried it to some plants. Especially a friend when came with some agricultural interest, he was trying some doings in a hill area. I was accomplished him, and I used some Silesia and Gali self medicine first for the cucumber, that is the bitter cucumber. For several days after he cannot attend to the plants in the hill area. But at the same time, for the 2 or 3 plants, I used the Silesia. Only that plants, 3 plants stand and all other things become dried. That was the first thing I noticed, and I tried a lot about the Silesia, and I was presented a paper in the last Irish conclave because I was tried a lot with this tincture and the chemicals which were found from the plant leaves and roots. That was the first thing which leads my experiments with these sort of mother tincture study, and it is a side way. This process got a very most interesting than the plants and diverted, and I studied a lot for these things, plants and our natural plants, herbals and homeo medicines, including mother tinctures from our pharmacy. From so many medicine tinctures I made personally and viewed under microscope and studied. First time on those days where I have got no even the this microphone, that is our mobile phone for taking, but now microscope also. Microscope got, but I was trying to the picturize with the pencils and got so many pictures. But after that, only after 3 years after, I got this mobile phone picturing facility, and after that it is very easy. I studied a lot of things, plants, including our Ayurveda. Even now, I don't think that for this 500 years, anybody saw the picture of the Kurundoti, etc. I saw
I proved it.
Yes, so I saw so many.
I proved with the help of my PG students.
Yes,
And now it is available in the market.
Crystal is very rare. This crystal pitcher is very rare. And I tea from Munnar, the Neelakurunji, I got this from the first page also. There is a very good crystal on the first. I think you can see this small crystal, very concise one. That is because that is the flower of Kurunji, Neelakurunji. Tea also is an acid, and that is tannic acid, and I think so many things I studied because of this. Only a picture book, I can't say anything about more about it, because what are the things, what is the ingredients chemically, but the pictures are similar and will not change. So many pictures even then are very typical and particularly very much specific to the particular leaves and flowers. And
it's one thing told me it
was an interesting thing that Silesia got, and I was so much astonished, and I was tried to see is there anything. I gave the plants to sugar of milk and then give Silesia. Is there anything which is deteriorating or something absent in the molecular in the structure of the leaves or plants? But I couldn't get so many experiments I done for the 3 or 4. I think that about 13 years. But after that, only I got the result that it is not deteriorating, because the Silesia is the part which is the only one remedy which gives the assimilatory aspect of the aspect of the metabolism. So I used the Silesia, so 1 potency and 10 potency, but didn't get any deterioration or the relaxation. But I got certain additional crystals in the leaves. That was an interesting thing. That was I was put forward in the Irish conclave, and they didn't give the chance to speak, but they give a poster presentation, and I presented there. And this was also here. I think you can see this presented. And this again at that time, and I was so much eager, and I want to keep the privacy of this. So I showed this only to the Leelavati madam. I was so much indebted to that madam. Doctor is not now here in Trivandrum. She is, I think, that in America. Otherwise, I strictly will try to bring her. She was the first one who saw all my works directly, and I showed a bunch of papers are there, which I showed there to Leelavati madam. And today again, I am so much indebted to Mr. What is called Musa sir and Gobi sir, because I was forgotten. This Musa sir was my first pharmacy professor. At that time, he was a tutor. And so much heartily I was with the Musa sir. I was the chairman of that college, first Union chairman. I was not so much deep to the political and leadership basis, but again, I want to say the IFPH members, all of you, I think that several persons are belongs to the BHMS graded and other things. But on the before or 1 hour before, Dr. Umman called me. I was forgotten for a long years, because with my colleagues, Umman was from Kozhikode, was coming for the practical. I think that strike of this diploma and degree, that was an event from my life, and I got so much. I think that it was so much blows, and the years passed. After that, even this NHM, only Ayush Ministry, Ayush department gave me a chance to work in homeopathy, and I am doing now. I am 57. My friends are all leave from their work, and now even now I am so strong. And I think that for these 3 years also we get this up to 60 years, and after then again for the 5 years we will get a chance to do the service for the homeopathy. And homeopathy will be the must and foremost one in the future because of these things. And again, one thing I want to say is, sir, so many days I was trying to take a part in this and getting an opportunity for saying something in this field, but there is no time allotted, and so I think that the my facilities in Idiki was not so much good. Now it is not good. But one thing I want to stressfully, Dr. Sir, Ismail Sir was so much told about this, and was very much interesting, and I want to do more about this field because of this chemical, this molecular structure, this especially the crystal energy.
Mashood, we have another session by 9 o'clock, please.
Okay, sir. I am trying 1 minute.
No problem. We can take some 5 more minutes.
How the crystals, everybody know that the nanoparticles are the utmost.
Dr. Marshood, no need of hurry. Let us. You can continue for some 5 more minutes.
Yes, sir. Yes. That is the nanoparticles for many things. When several classes I was trying to say about something, but for the comments I can't, because I want to know how far it will reach. That is why I don't say about it's nano. In the 10th potency, or in the 30th potency, 24th potency, all potencies shows nanoparticles. But what is the difference between these higher potencies and lower potencies? That is a fact one. The second one is, even in a micromolecular structures, the molecules arranging in a such a way, then it will not become the crystals. Everybody, we all must know the crystals, how it forms. Molecules, when it is arranged in the negative and positive ways, even in the atomic negative and positive attachments, intermolecular attachments, they will not form the molecules. But how the molecules are formed?
Dr. Marshood. I think you can have a session either as per your convenience in our platform for half an hour or 1 day. Whatever Dr. Manoj will contact you and fix the date as per your convenience. So I think you can explain all those things in that platform, because our guest Dr. Lakshmikant Nanda is waiting to complete the session, and thereafter we will have another session in English and Malayalam. Our guest is about to join, and although he has joined, there is some technical problem with his audio system, so we are waiting for him. So
Okay, sir.
okay.
Thanks to all. Thanks to
Okay.
all. I
Hope you will come with one presentation here in this platform, and definitely we are waiting for the same.
yes, sir. We can. I am
Now I
also
think we will go back to our,
trying and
our
reading.
original
Again, I
session.
want to. This is my first book. Manusha Sharirathile Moolangal. It was written in Malayalam at that time when for 1910. Sorry, 2010 when I was in Trivandrum. At the time, this book was completed and printed. And for the second week, I got a NHM medical officer post in Idiki. That was it is a lucky book. This was only for trying to show my eager and enthusiasm to show and to most it is more it is for the privacy. Keeping the privacy is that is was so much privacy keeping. So I suddenly go to
Dr. Ashok, now we have to finish the program. Dr. Sir, please.
And I am also okay.
Yes.
Okay. Thank you, sir. Thank you so much.
Thank you, Dr. Mashood. Now we'll talk to Dr. Nanda, who is waiting online. So, sir, I think we will have another session, a part 2 of your session on 27th of this month. Is it okay for you, sir?
Nanda.
Okay. Okay. No
Okay.
problem.
Because
we are
need,
happy to see you again.
we need to hear we wanted to hear the next 2 cases also. So please come to our forum on 27th of this month. We will have a better discussion on that day.
Okay.
Now I invite Dr. Yahya to say a vote of thanks to Dr. Nanda.
Thank you, Dr. Jose. So on behalf of IFPH, and all the dignitaries here, so I extend my sincere thanks to Dr. Nandha. So it is the session is not completed, but due to unavailability of time, so we were forced to stop the session. But the next week again he will come forward with more cases, and from my heart of hearts, I extend my sincere thanks. Thank you, and all.
Thank you, Mashood. Pray for him.
Yes, Mashood also. So everyone have to buy the book and help Dr. Mashood to write more books. So I extend my sincere thanks to Dr. Mashood too. Thank you. Good night. Over to Dr. Danish.
Namaskaram.
Please close the screen sharing.